Hello everyone, and welcome to the Health GoLIVE webinar series. Today's episode is brought to you by our friends at Ginger. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Stay on after the webinar for a peaceful meditation led by behavioral health coach at Ginger, Lauren Ersch. And with that, I will throw it over to our moderator who joins us from What's the Future Health, Jessica DeMassa.
Hello, and welcome to this Health Go Live. We are talking about the supply and demand imbalance in mental health, and very excited to be here today. And kudos to Ginger for curating a great panel for you guys to hear really across healthcare ecosystem perspective on how we can tackle this problem. This is nothing new. We've been in a mental health crisis as a country for a couple years now, but the situation obviously exacerbated by the events of last year, not only with the pandemic, but a lot of the turmoil, social turmoil, economic turmoil, political turmoil that hit us in 2020. So very excited to talk to this group about that supply and demand imbalance, how it's changed over the past year so we can all have a greater understanding of the issue at hand. If you've noticed, all of these companies are very well known for being having a penchant for technology. So I'm sure we'll get into how tech could perhaps help resolve this supply demand imbalance. And then the last thing for me that I'd like to find out from them is, what needs to change when we look at the healthcare market and we look at the healthcare system, from a macro view, what types of health policy or what types of payment model innovations need to change so that we can make sure that people who need access to mental health care have it. I'm Jessica DeMassa. I'm a health innovation reporter and the host of WTF Health, What's the Future Health. I talk to the who's who of health innovation and health technology, and I'm very excited to talk to this panel here. So why don't we dive in and meet them? We'll start out with Dr. Jenny over there at One Medical. Why don't you introduce yourself, tell everybody real quick what One Medical does in case they're not familiar.
Great. Thank you so much, Jessica, except I'm not a doctor, just play one on TV. I'm Jenny Vargas, and I'm the Chief Strategy Officer at One Medical. And for those of you who don't know, One Medical is a membership-based national primary care organization in which we provide same-day, next-day appointments in our beautiful offices. This is our most recent office that we opened in LA. And we provide 24/7 video chat and other services, including COVID testing, COVID vaccinating, and more recently in 2020, or actually go back to the beginning of 2020, before the pandemic, we introduced our Mindset offering, which is our behavioral health offering, which I can talk about in more detail as we go through the panel. My background is, before One Medical, I joined about 3 years ago. I was at Stanford University's healthcare system as a chief strategy officer for 10 years. And prior to that, I was 20 years on the publicly traded payer side, which just basically means I'm very opinionated on any subject in healthcare. So ask me any question, I have an answer.
Good. I can't wait to hear more of that. I'm glad I handed you an honorary doctorate. And then these other two I know do have doctorates. So Dr. Sean, why don't we go to you next? Introduce yourself for us, please. Let everybody know what Oscar Health does in case they don't know, or in case they're also anxiously awaiting that IPO like I am.
Yeah, thanks, Jessica. And I'll start off by saying I share your excitement. I think it's a really timely and important topic, and especially feel blessed and humbled to be able to have discussion with such esteemed colleagues. So, Sean Martin, I am a senior medical director with Oscar Health. I'm a general internist by training, spent some time practicing primary care before being increasingly intrigued by the ways that technology could be utilized to bring about healthcare transformation. And that led me to Oscar, where I currently provide clinical leadership over our member programs organization, which is an aggregate of our population health, behavioral health, pharmacy, and our virtual care delivery platform. And so for those of you not familiar, Oscar Health is an insurer. We're based in New York, and it was really founded on the premise that healthcare is just far more complicated than it needs to be. And so our founders really saw an opportunity to better leverage data and technology to drive both more affordability and simplicity, I think, in healthcare through more personalized experiences. And so we started out about 8 years ago now, started out with a focus on the individual market and have slowly expanded, currently sell plans in the individual, small group, and Medicare Advantage lines of business, currently in 18 states. And as we wrap up 2020, have about 420,000 members with us.
Very exciting. All right, Dana, last but not least, introduce us to yourself and to Ginger for us.
Great. Well, thank you so much for having us, and Jessica for hosting. I'm Dana Udall, Chief Clinical Officer at Ginger. I'm a psychologist by training. I've been in the field for over 20 years working as a provider, so a clinician, an administrator, a supervisor in lots of different settings, everything from residential care, outpatient, inpatient, university health centers, private practice. I came to Ginger about 3 years ago because of the supply-demand mismatch and the burnout that I was experiencing as a clinician. I remember coming out into the waiting room, seeing so many people, it was just packed to the gills, and thinking, our system doesn't work. We've got to find a way to scale care and innovate to really solve the mental health crisis. So Ginger provides care at 3 different levels: coaching, therapy, and psychiatry. I oversee that care treatment and make sure that we are delivering high quality care in our on-demand collaborative care model.
All right, perfect segue. So Jenny, I want to start with you here. And I'd like all of you to weigh in, but I want to start with you, and I want to talk about this supply and demand imbalance. And I really want to unpack it so that it kind of level sets the rest of this conversation, because in thinking about this, when I started looking into, the reason behind the webinar here, it's like, I feel like we all have to have an understanding of what the problem is that we're solving. And I think that, like, even my own thinking about the supply and demand imbalance for mental health care comes from a place that was like pre-pandemic. And I've just like, oh, well, I can't imagine that it got any better. So I'd like to hear a little bit more about the changing complexion of this, because I can't imagine, like I said, that it's not, a greater imbalance in that supply and demand. I'm curious about whether or not it's the same kind of supply and demand imbalance across different diagnoses. Like if you have anxiety versus if you have a more severe mental health disorder. I'm curious about if it's regionalized in any way. So any detail you can give us, Jenny, start us off by kind of explaining where we're at with this right now.
Well, thank you, Jessica. It certainly is a huge, huge concern. And I will leave it to the clinicians to provide more details about, the change in diagnosis post-pandemic. But we at One Medical have always seen a fairly high percentage of mild to moderate anxiety and depression in our population, because life is difficult, it's complicated, it's challenging. And now that we're in the pandemic, it is even more so. So we have always been very focused on our primary care providers being the first place you go with your concerns, and they spend a long time with the patients, understanding what might be bothering them. So our behavioral health program is rooted in the primary care physician being the starting point for diagnosis, for treatment, for prescription, if that's necessary. In terms of the supply and demand, what we notice is that if someone needs therapy or coaching, that we noticed in probably 2018, 2019, that we could not get an appointment fast enough. We believe in same day, next day appointments. Rapid access for everything is the key to improving people's health. So we started through our mindset program to offer our own coaching and therapy. So that's been extremely successful, as well as group visits, which is another way to reach out to people around stress and anxiety. Very popular programs that are conducted in our offices after hours. Now, when the pandemic came, everything had to go virtual. So it means we're doing all of those things virtually. And continuing with that, and as well as allowing people to schedule remote visits with their normal providers, during normal office hours virtually, as well as 24/7 video chat. So we've just greatly upped our virtual offerings, and we've added an enormous number of behavioral health staff during this time.
Can you give us a sense real quick, maybe, you had mentioned that you had noticed an uptick in 18 and 19, then developed this program. What did you see in 20? I mean, I don't know if you can share specific numbers, but I mean, like how prevalent did it become that people were going in and talking to their primary care provider about needing some sort of mental health help?
Yeah, I don't have any good statistics for you in our patient population of what changed. We haven't, it's so recent and we're so in the middle of it that we haven't, anecdotally, it's reported that, of course, people are anxious, right? And also I think what's going on is we reach out to people to say, if you are anxious, schedule one of the following things. So, I think we've just gotten much more direct with people about that's normal. So, but I don't have any trend data to share with you today. I'm sorry.
I bet Dana does, because she
I
looks
bet
like
she
she
does.
wants to weigh in. And I believe that there's some research that might be coming out soon about this. So she's getting so antsy over there. So Dana, tell us.
Could you tell?
I'm sure that yes. And I'm excited to hear what you have to say about this, because I really do want to hear about how things may have shifted. And thank you, Jenny, for putting it into the context of things were already ticking up. And so I want to hear about, how through the roof demand went over this past year and where it's headed.
Absolutely. And exactly what you said, Jenny. So we were seeing this increase in utilization of services. When we look back today at our data right now, for example, for January versus pre-COVID, we have seen about a 200% increase in our coaching utilization and about a 320% increase in our clinical utilization. So huge increase in people using services at various levels. We also see different usage patterns. So for example, we've seen a 50% increase in overnight utilization between 10 p.m. and 6 a.m. And that's great. That means people are talking to their coaches, which is better than doom scrolling, but it also means they're not sleeping. So they're probably anxious and depressed. And we know there are some profound consequences for both mental and physical health when people are not sleeping. So we are seeing this, it's very sort of evident on our system. The other thing that I will say is that we are seeing both an increase in new diagnoses, so people who never had symptoms before are developing them. Those who maybe were in recovery, let's say from an eating disorder or substance use, their symptoms are often coming back. So it sort of is around the board that people are developing for them for the first time and exacerbating symptoms. So we are seeing this full-fledged, and it's really evident across our system at all levels.
Sean, what do you want to add to that?
Yeah, I was going to say, I think we have a bit of a unique perspective as a payer because we see kind of across the population, right? And so I think we've seen, I would say, some of the same and some new, which goes along, I think, with what you heard from the others. So interestingly, looking back to pre-pandemic, we have always seen, actually, so probably for some context, so we have about 40% of our members come to us to seek advice around when they're seeking care services, right? We call them requests for visit services. So, hey, I need an orthopedic surgeon, I need a psychiatrist. They come and seek our advice. And so we kind of have a rich data set around this. Back in 2019, the number 2 and number 3 reasons people would come to us were anxiety and depression. Okay. Going into the pandemic period, number 2 and number 3 are anxiety and depression. However, we have seen a 50% increase in the number of searches for each of those, to the point where now 1 in 7 requests is either related to anxiety or depression. On the newer side, I think 2 emerging conditions that we've seen. One, pretty interesting, trauma and stress-based conditions actually has increased to the number 3 request for mental health services. Makes sense, both around the pandemic as well as a lot of the social justice issues that are going on in our society right now. And then the other one that probably not surprisingly has jumped up is substance use disorder. We saw about a 70% increase in substance use disorder utilization. And then I would also echo, I think, some of the comments that both Jenny and Dana have made around telehealth utilization. So by mid-year 2020, we were seeing more than 75% of all mental health claims were coming through as virtual claims. And pre-pandemic, that would run around 5 or 6%. So substantial uptick in the utilization of virtual services to manage mental health.
Okay, I want to come back to this telehealth virtual care conversation. Do not think we are getting off the hook on that in any regard here. But before we come back onto the tech as a solution to a lot of the problems here, I want to understand one more thing on the supply side of this. What in your opinion, and I think, Sean, I'll just start with you and we'll go back around, but what do you think is kind of perpetuating the limited supply? Is it a lack of clinicians? Is it like a lack of distribution, like we're seeing with the vaccine, where it's like the COVID-19 vaccine, there's supply there, there's definitely demand, but there's just trouble with that middle infrastructure to get it to the people who need it? Is it an awareness thing? Is it a cost not being matched to the supply side? Like, I want help, but I can't afford it. What do you think is kind of making the supply side of this hurting that equation, I guess, in your regard?
Yeah, I think the reality is probably a little bit all of the above. But I think you framed it really nicely. And I'm not yet convinced that this is fully a number of providers issue. It could be. I fully acknowledge it could be. But I am convinced, very much so, that our care delivery infrastructure around mental health services in this country is unequivocally not where it needs to be. And so until we fix that, I think it's a little bit difficult for me to say, no, there's also a provider number mismatch. And, I'll probably ask Dana to fact check me a bit on this, because I know this is the world that she lives in every day. But I've been led to understand that about 90% of mental health services that folks need can be managed through coaching, right? And that's a much less formal mechanism, often doesn't require advanced clinicians, often doesn't require clinicians at all, appropriately trained, certified folks who can manage through skills and mindfulness teaching and support 90% of the needs that we have out there. And then of that last 10%, the next 90% can be managed by non-physicians, right? Therapists, psychologists who are advanced clinicians, but not necessarily physicians. So you're really talking about the physician need just at the very, very tip of the iceberg. And so, my hypothesis, or at least one of them, is that until we're able to kind of rejigger the infrastructure to match that better, and I don't think we do that well at all today, we're going to continue to struggle. And the example I'll give you on the medical side is, if someone has a heart attack or is about to have a heart attack, we have great treatments for that, right? And we have wonderful cardiologists who can manage that. But any cardiologist worth their salt will tell you the best way to reduce morbidity and mortality from heart attacks is to prevent them from happening in the first place, right? And that's a years or even decades in advance investment in reducing risk factors. And so I think of that as the potential role for coaching, which is really missing in our ecosystem today, is let's give people the skills, the coping skills, let's teach resilience, let's teach mindfulness. And then the hope is that we won't need as many advanced clinicians on the back end, because we're managing mental health more holistically in this country.
Okay, so interesting. So not only like helping with the supply side by kind of reshaping what demand means by addressing things earlier in a more preventative way, but also, and we're going to let Dana jump right in on the matching intervention to acuity piece of this. So say more about that in terms of like where, Sean, I think that was an excellent way to walk through everything in terms of like kind of unpacking like where the supply, where this store of supply is not being able to be accessed by people who need care. Dana, say a little bit more about what your thoughts are on that.
Yeah, you bet. So it is a sort of both and. It's a really complex picture. So we know, for example, that the projection is in 2025, there will be something like 15,000 too few psychiatrists. Then if we look at psychologists, it's about 50,000. School counselors will be 60,000. Those are the shortages projected. So for adults, for children, there is just not enough access. But Sean, to your point, even if we had all of those clinicians in seat and ready to go, it still would not serve the need. And that is because we don't have that layer in many systems of prevention. That sub-acuity, that level is not really addressed. So you have to have a diagnosis in order to get care. We know that many people are not accessing care for months or years. By the time they get it, then their symptoms are rather entrenched, so their outcomes are worse. It's harder for them to get better. We really need to change the paradigm. So we're treating those 4 out of 5 folks who don't have a mental health diagnosis. We're doing that prevention work. We're catching their symptoms early to make sure that they don't need those higher levels of care and they don't overuse that expensive layer. So that is exactly what behavioral health coaching does. It really does skill building. It teaches people interventions early. They can really practice with that coaching level. We also use a lot of content on our site. That means that people can go on by themselves and do self-directed work and then talk with a coach. The coach will check in and say, how did that go? Did your anxiety decrease after doing that mindfulness work? So it really is that level of care that is scalable, will help more people get in the door. The last thing I want to say is that there is a different, we know that this disproportionately impacts marginalized groups. So communities of color, for example, who have never had great access to care, that is an enduring feature. We know that it's still very hard to access care in some communities. There may be stigma, shortage of providers, lack of culturally competent care. Telehealth can help solve some of those things, but we still need a pipeline of clinicians who are from all groups and who are culturally trained so they can really meet people where they are and provide that level of really relevant service.
Jenny, what would you add to that? I mean, like the primary care doc, the front line of all healthcare. Now they got one more job, is to help kind of identify some of these mental health conditions before they become, too severe to be treated with by a health coach. I mean, from your perspective, is that really the supply problem here, or what are your thoughts?
Well, I think it's part of the solution is our role in primary care. And what we do at One Medical is we push out PHQ-9 and GAD-7 surveys. I mean, the beauty of having members is that we're having lots of interaction with them. So we can very nicely and not in a threatening way say, could you fill out this questionnaire about how you're feeling? And we get fantastic response. Our primary care provider can see it, early signs are detected, bring them in for an appointment, talk to them and refer them, right, to a therapist, a coach, whatever it is that's necessary. Just two other points about the problem of the supply and why we find ourselves here that I'd like to raise and put on the table. One, I take credit, or blame, I should say, from the early days of managed care when we separated behavioral health from physical health, and we had, carve out behavioral health. Basically, in some ways that killed the behavioral health industry as the rates went down, the focus was on how to do it the cheapest way possible. And even today, many therapists, and Dana can speak to this much better than I can, but can build a much more successful private practice outside of insurance. That's a terrible outcome that we're living through, right? We've not made it a great career for well-trained therapists, coaches, because we sort of killed it. The other issue that I think we need to put on the table is licensing and across state licensing. So anything we do in the virtual space, we're limited by licensing. And the fact that you can't treat across state lines is a real problem for expansion. So we could really scale up the supply if we didn't have that problem.
Sean, you want to jump in on that real quick?
I couldn't agree more. I mean,
Okay.
I think, and I don't know where you want to go, Jessica, but I think that, Jenny raises, I think, a fantastic point around medical behavioral integration. And I think that's something that we are very keenly focused on at Oscar in the near term as part of our roadmap, both virtually and I think in the more traditional model. And, she couldn't be more right.
No, I'm curious.
About,
that's good to hear. That's good to hear from the payer perspective. Let's transition and talk about tech real quick, because I do want to, you guys have all mentioned it in the course of kind of, unpacking the problem here. And I want to shift to whether or not we think that some of the different tech solutions out there that are mental health focused are really the magic, silver bullet that we expect them to be. I mean, I track this space. I follow health tech funding. I have a show that covers health tech funding deals specifically. And this year was a monster year for digital health broadly, 14 billion or 21 billion invested in the space, depending on whose report you go with, Rock Health or Startup Health. But, a large part of that, just from covering it, was mental health startups. I mean, we're sitting here right now, Talkspace is filed for an IPO, which is just pretty incredible. I don't know if we would have seen that in 2018, all circumstances remaining, the same back then. So I'm curious to hear from your perspectives, how much of an impact do you think technology can make? And I want to I'll challenge you too with not just relying on telehealth here, but there are all these other things out there, different applications that can detect, somebody's, whether or not somebody's having some sort of a mental health crisis by the sound of their voice, or there's, the cognitive behavioral therapy, digital health solutions that will walk you through your own, care plan, or there's, there's chatbots that can interact with you and offload even further from a coach or a real human being and kind of prevent things at the very first levels. And I mean, these things range then all the way up to something like Ginger is providing, where there's different levels of access to people, clinicians, to intervene. So Jenny, kick us off here. I mean, what are your thoughts on technology? Is it the silver bullet to solve this problem?
Well, I think it can help. And
you laughed. That's not encouraging.
I'm not sure it's a silver bullet, but remember, I'm old. And so, maybe I'm not the right demographic to.
No, you're the perfect demographic.
But the way we think about it at One Medical is all of our technology has to be rooted in a longitudinal personal relationship with somebody. It can't just be technology. People, around One Medical, our patients say they love One Medical. That's because they have a relationship with us. And I think we're only as good as they feel about us, right? So one of the tricks of point solutions, and I think there's some really exciting, cool things out there. Async, I won't name any of the companies, but these cool companies that can monitor how you actually interact with your phone, not what you say or type, but even how quickly you use it can indicate, an upcoming episode of which would be very important to monitor. So I think we're in such early stages of real technology solutions where there's something asynchronous that can lead to a treatment or, connecting all of these different things, right? The prevention, the identification, the treatment, the return to health, the part of your overall healthcare experience connected to your medical well-being, not just your mental well-being. There's so many things to do, but I'm very, very excited about, actually, I think the funding is a great sign that people understand that this is super important and we got to fix it. And why not use tech tools?
Sean, what do you think? Oscar's got a reputation of being probably the most tech-enabled health plan out there. At least from the very beginning. I remember I had Oscar back when it was first launched, and it was like, it had telehealth, and it was amazing. And that was like 5 years before this became like table stakes. So, what are your thoughts on technology and integrating some of the, whether it's the different point solutions or, relying more on virtual care? How are you guys looking at this?
Yeah, when I think about technology, I think it's really good at two things. One is enhancing access, bringing access to people who otherwise, in a traditional brick and mortar system just wouldn't have it. And then the second is enabling scale, which is something else that's very, very important. However, what technology does not do, I think to Jenny's point a little bit, is it does not solve any of the foundational problems that we have in our system related to clinical practice transformation or broken payment models. Right. And so my framework for healthcare transformation really includes those three elements. Number one, you've got to have clinical practice transformation. Number two, you've got to have payment model transformation. And then to me, within that schema, technology then serves to bridge one and two into an integrated and scalable model. And that's critically important. It's absolutely critically important. But I think it really will require all three coming along together. And I think that's why you're beginning to see and will continue to see payers and providers work much more closely together around this so that all three kind of come together.
Quick follow-up on that. Do you think it can bring the costs down? Because that's always one of the things that we're looking at in like the digital health space specifically, or like digital therapeutics or things like that, is like having the ability to leverage the technology to drive down the cost. Is that something that you guys have your eye on over there at Oscar as you're building your plans? Oh, and Jenny has something to say right after that.
Yeah, I would say absolutely. I think Jenny may be better positioned to give some specific use cases, but I know at least on the medical side, the way we've leveraged some of our virtual services absolutely has enabled us to pull costs out of the system through things like ER diversion and other things. And I think that through better medical behavioral integration, I see no reason why that won't be the case on the mental health side as well.
Jenny, I'll bite on that enthusiastic nodding. Go for it.
We have great data. We participate in ACOs across the country where we can show our patients, almost never go to an urgent care center, use the emergency room at half the rate because we're available 24/7 and they can get in for an appointment the same day, next day. So we even had a study published in JAMA with an employer where we showed that we saved 45% of their costs because it really is about access. It's fast, it's easy, we're friendly. There are no barriers. We're not making rules and regulations about why you can't talk to us or, mother, may I? So I think that technology, the problem is if technology doesn't have a really open front end and doesn't fit into your ecosystem in an understandable way, I mean, you can't have 1,000 apps that people have to access to get stuff, because you'll just never remember it. If you don't access enough, you won't be able to use it.
All right, and Dana, you're in this space. I mean, Ginger is one of these companies that is using technology to, recreate not only the model for mental health care delivery, but also, in effect, drive the cost down, as you explained, by, providing like different strata of care with different levels of practitioner up and down it. So, I mean, this is a softball question for you, but I guess I'd love to hear within Ginger, how are you guys looking at even taking your tech further to help, resolve the supply demand issue?
Absolutely. So, our thought is really that tech is incredibly helpful, but that it is the humans that are really driving care and making these complex decisions. So mental health care is so nuanced and specific. There are individual differences, group and cultural based differences that we need human input for sure. The way we think of tech is that it supercharges our care team. So we're able to surface a range of data points very quickly to our coaches and clinicians so that they can make inferences and make treatment decisions based on that. One of the things we use is natural language processing, and that allows us to understand words and word patterns that the human eye or brain might miss. But we can surface this information and the coaches can understand quickly, oh, this person may be at risk for decompensating or becoming suicidal, or this person may need therapy or psychiatric services. So it really allows us to provide a personalized experience based on what members are telling us at the time of need. So it allows us to be more efficient, effective, and it does reduce costs. If we're understanding things more quickly, we have found, for example, that if we add coaching to clinical services, people get better more quickly. So it is that integration that really leads to better outcomes.
I want to talk a little bit more about that integration, because I feel like last year it became suddenly, as payers, providers, individual clinicians are struggling to provide care. It's like it seemed like this adoption of a portfolio approach of solutions seemed to be the thing to do. So it's like we've got the clinician at the one end, where you are getting care delivered from a person, all the way to the other end, which was completely self-service stuff, like those CBT types of things, or maybe a chat group that you could join into, or things like that. So I'm curious about this portfolio approach. Do you think that this is the way forward in terms of helping resolve that supply demand issue? And if so, I'd love to hear how. And I think, Jenny, if you could kick us off with that, because from the provider side, we'll start with the provider, we'll go to the payer, and then we'll actually talk to Ginger as they're kind of probably in the process of building something out like that. But, with the providers, with the primary care docs that you're working with, Jenny, I mean, how are you looking at, fitting them in, and then those other types of clinicians that are maybe more specialized in mental health? How does that portfolio approach of live clinician, self-service point solutions, and everything that exists on that spectrum in between, how does that portfolio approach appeal to you and what you guys are doing there at One Medical? Do you think this is the way forward?
Well, first of all, thank you. Yes, and there's certainly a proliferation of offerings. We have our app that, homegrown, our EMR and app, and physician workflow, which is a very, very important thing to us, is just as we like to delight our customers, we also want to delight our providers. So anything we do has to fit into workflow so that they can normally do it. But we do have a way to help them refer, and we can serve up to them in the app what is the most appropriate for a person, and their benefits that they have with their employer, or, depending on what the situation is. So I do think that, but to the point about, there has to be a home base. There has to be a connection back to somebody that knows you, sees all of your issues. And even if you get referred out to something quite far away and you love an app or an experience, it has to be connected back to your overall healthcare. So we believe that we, play a really, really important part, as any primary care provider would, in this. And I think one of the sort of sad states of affairs is that primary care providers don't get enough attention or representation or thinking about their role in reducing mental illness. And I think we could do a lot better job on that.
Okay. Sean, do you want to add anything to that? I mean, as far as building a portfolio within your own, you know, what Oscar is offering, and also maybe like if you could touch on a little bit about like the payment model, the payment, the payout, you know, behind that, that would be great if you could contribute that.
Yeah, I think there are a couple things there to unpack. One is I'll go back. I think the integration, right, is the key here. So I fully acknowledge that I think meeting people where they are in mental health was absolutely a critical first step. But you know, I think we've now got to move back towards, okay, how do we bring all that back into a central fashion? And it goes back to, I think, what Jenny said. I think you know, the notion that we segment out mental health on its own is ludicrous. I don't, you know why we ever did that. It's not mental health care, physical, it's just healthcare, right? And I don't think anyone would disagree that mental health unequivocally influences physical health, and physical health unequivocally influences mental health. So why we would separate them and treat them differently, it would just make no sense. And so I think the integration point with that regard is very important, because otherwise what we're going to do is we're going to actually fragment something that's already too fragmented. And while we may be solving an entry point problem, we're just going to be creating a new problem for ourselves down the road. So I think in terms of payment models, I think the way we think about this is that we really need to, much like we saw on the medical side, move increasingly towards a focus on value. And the behavioral health side is just a little bit further behind. It's still very transactional, fee for service. I think a number of the reasons for that were well listed earlier, including just non-sustainable reimbursement. And so I think we really do need to, I think, rethink about how to integrate high-performing behavioral health networks into the broader network and into the care delivery system. And it's going to be important to do the types of things that I think Jenny suggested, right? You need measurement-based care. You need quantitative performance standards, right? You're going to need to require integration across the broader network so that it's not, you know, in isolation. And then I think if you can get there, then I think it will also be important to have as many entry points and touch points as possible within a portfolio. I don't know that you necessarily need to have all of them, but if you can add that on top of, you know, quantitative performance and value creation and an integrated model, I think that really is what we need to move towards.
I'm gonna take a quick question from the audience, from our viewers out there, because it kind of fits right in. And Sean, I'm going to stick with you on this, but ladies, feel free to weigh in as well. The question about it is, you know, how do we better connect the payment payout to health coaches, therapists? I'll add in there digital health solution providers. So there's an incentive to utilize this continuum of care. Like, how do you incentivize that? Like, how do you better connect the payment payout to some of these other types of solutions for providing care?
Yeah, again, I think you need to move away from the transactional notion, right? That claim equals payment, right? And you have to define, you know, shared and aligned incentives around, listen, like, this is what we believe high quality care looks like. This is what we believe high quality outcomes look like. And then worry less about the how and worry more about where you're going, right? And then if you can decouple your payment from that transactional model and focus more on, hey, let's just work together to get there and do all of the important pieces that we both can do in collaboration to enable each other, then I think you can get there. Now, I don't necessarily have a clear-cut example. You can see some sides or some examples on the medical side where that's being done, you know, pretty successfully. I think there's an evolution that's going to have to happen a little bit on the mental health side. But I think it's coming, and I can tell you that I'm talking to any number of folks in the space who have that mindset and are excited to have that discussion, and so we're excited to engage them. You know,
Dana, jump in on this, please, because I mean, you guys are living this life of trying to advocate for this, right? So, I mean, I'd love to hear your perspective. You know, how is this conversation going? Because anytime you hear about any of that, whether it is, you know, changing the payment model for different mental health solutions, or making sure that telehealth is still reimbursed at parity after this pandemic, or like whatever the issue is, whenever you're trying to integrate something new and have to take a look at the payment model and have a hard conversation about costs and payment, it's like there's always some pushback. So give us a sense of like the reality of like how this fight is going, I guess.
Definitely. So one of the things we're really focused on at Ginger is building our research and evidence base. And I think data here is key. So we know that around 70% of folks on our platform, many of who are in coaching only, have a full symptom response due to care. So that means within an 8 to 12 week course of care, their symptoms are reducing by 50%. That speaks to the value of coaching. We've had 2 peer-reviewed publications that are either coming out or have come out in the past year to really support this. So it is building that evidence base. I think a lot of it is also talking about what coaching is. Coaching has come an awful long way in terms of legitimacy and credentialing. Most of our coaches have what's called the National Coach Certification, which means they have attended a highly rigorous program, sat for and passed this exam. So these are some of the data points that we can say outcomes are here. Here is the data. This is visible that people are able to make these changes, and then really working to have these conversations about, it is about where the person gets in the end. Are they present at work? Are they effective? Are they productive? Regardless of which method of care they get, it doesn't have to be that traditional therapy only model, because we know that that is so limited in very many ways.
Jenny, do you want to add something there?
Well, I would just like to mention that how providers are hired, paid, and treated is very important for the success of all of these programs. And One Medical is extremely committed to salary only for our providers. We give them plenty of time to do the work they need to do. That includes our coaches and therapists. And we make their work as easy for them as possible. We call it removing, waste on desktop medicine. So they don't spend their time just charting and following up, but they are fully dedicated to our patients. So we hire for customer service, and we are very, very proud of our over 90% net promoter score, which is unheard of in the industry. But it's primarily because we treat our providers well. And so they're happy, and then they can make their patients happy using all the tools available to them.
All right, I am going to pivot a little bit, panelists. So hang on to your hats here. We've got a question that keeps rising to the top here, and I think this is it's the sentiment behind it. There's a couple that are in here. I see them, you guys who are watching, specifically talking about the socioeconomic issues around patients and how that's impacting their access to care. And so I'm hoping that, I promised we were going to talk about, from an impact on the healthcare system and a 50,000 foot view. I mean, I think like this is no better place to go than here, because I do think that this is very timely and very relevant, and it does touch on all of the issues in terms of, cost, quality, access, and the like. So Dana, we have a specific question for you. I'll start it there. But in terms of mental health in marginalized communities, how can, this is specifically about language barrier, but how can Latino and other limited English communities get the mental health they need through tech innovation?
Absolutely. One of the things on our roadmap to roll out very soon is Spanish speaking services. So we are committed to providing services in Spanish. That's very complex on our system because it involves our natural language processing and all of our algorithms. So it's a significant amount of work, and we are really dedicated to making that happen, as well as to having other languages rolled out in the future as we go. A lot of what we do is cultural training, cultural competence, and that's not a status. You never get there and say, as a clinician, I'm culturally competent. It's about being aware of our own biases and developing skills and interventions that work for whoever we're sitting with in that moment. So we do an awful lot of training on that. We've developed a lot of content this year as well on things like dealing with racial trauma, getting support as a person of color. We're doing a lot of internal work on racial justice as well. So we have a whole stewards program for different affinity groups, different sort of groups within Ginger, to make sure our care team is really, really well trained and that they have this sort of lens as well. So this is an issue that is going to take, a long time to solve. We need providers that are Latinx and of all backgrounds and ethnicities in order to really fix this, and we need to incentivize those groups to become care providers. But it's something that we're really committed to working on every day.
And that's going to take a while to do. And Sean, I'll come to you in a second, and I'm hoping that you can weigh in on this. Another question from the crowd was, how do you drive utilization within these typically underrepresented groups, overall? So, I mean, Sean, if you can make your point and then maybe weigh in on that as well in terms of driving utilization overall, I'd love to hear your ideas there.
Yeah, and to some extent, I think that the two overlap. I was going to say, I think it's equally important to have what I'll call culturally competent entry points, because there are also very specific stigmas associated with certain cultures, and the way that you communicate and kind of break down some of those barriers is very, very important, especially when that person, they're reaching out, but they may not be really telling you what the problem is. And so, we have multiple Spanish dedicated concierge teams for that purpose, really getting to know people, understand their culture, so that we can hopefully destigmatize some of that, and then ultimately get people to folks like Dana to get the help that they need. I think the second piece, I think, is probably two things. Number one is you have to, I think, have an understanding of the issue yourself and break down your own biases, unconscious biases. And then I think that the second piece then is to help bring awareness and do some of that destigmatization that I mentioned. And so, one of the things we're very aware of this. We ran an analysis in our New York network at one point looking for provider deserts. And about a third of all the zip codes in New York had fewer than 3 mental health providers. Now, New York, that can be tight space. You say that could be a few hundred yards apart. But what really stood out was that was disproportionately represented by areas of low income and most notably people of color. And so there are very real access barriers that these folks face. And so I think we've made a real effort to outreach folks in general, pull them to our mental health landing page to educate them on what services are available. And I'll give you a point. I think there's a real appetite for this. So in the midst of the pandemic, we sent out an email campaign to our membership, just saying, hey, we're here for you. We know things are tough. Here's our, some information about your mental health benefits. 40% of the people that we sent it to opened, which is an astounding open rate. That was about 7% more than any other email campaign that we ran in terms of open rate. So people are craving access to these types of services. We just need to reach out to them in the right way and help guide them.
I want to hear the conversion rate on that, Sean. How many of those people opened it and then did something? Yeah. Jenny, did you have anything you wanted to add in terms of strategies for helping those underserved populations, I guess feel like they can utilize some of the mental health services that may or may not be available to them, whether it's a matter of making sure that they have access to them, or if it's a matter of, helping with language barrier, helping with affordability, things like that.
Just a quick add that we found in our population that LGBTQ members really wanted to access to services. So we started a really cool group program for them, led by our providers who are very, very passionate about this. So I think it's finding, you have to have multiple solutions, I guess would be my concluding remark, right? For the different segments of the population, and really listen to what they're interested in, need, what would help them.
All right. I am looking at the time and I am looking at the list of questions, and I want to do one more thing before we kind of wrap things up, right? So I'd like everybody to get their crystal ball out here, because there's a couple questions about a couple different topics that I think we can wrap into a future casting kind of conversation here. So Dana, let's start with you. I'm curious about the year ahead. And I'm also curious about beyond that. So if you can think, maybe in your answer, talk to us about, short-term 2021, maybe to the top of 2022, and then beyond that, kind of what's going to happen in terms of mental health care. I'm seeing questions about state licensing. What's going to happen with state licensing? Some of the health policy things around that. What do you think is going to happen? As far as integration of mental health care with physical health care, questions about that. I mean, Sean, to your point earlier, there's an appetite for this. Jenny, like what you said, this made no sense that we did it in the first place. So are we, from either a policy standpoint or a business standpoint as an industry, going to get our act together and lay the groundwork for reintegrating those two things as a result of the pandemic? So Dana, like I said, I'm going to start with you, but I'd like all of you guys kind of to weigh in on that spectrum of what's going to happen next for our industry as we look to resolve the supply and demand imbalance.
So we are deep in the throes of integrating with a couple different organizations, Oscar being one of them. So we are thrilled with this new partnership. We are providing clinical services to Oscar members and integrating with their PCP provider, so primary care. We are doing this more and more. This is absolutely the way that things need to move, because there are so many comorbidities between mental health and medical disorder. So that level of integration we expect to continue. We're building our own EHR. We'll create more of the pipes to allow that seamless experience and make sure that mental health care is not sort of in the shadows or delivered on the side. We are also going to be rolling out adolescent services. That is another very underserved population that can tremendously benefit from telehealth. So that in Spanish are on our list. And then as well as working with more payers and health plans. So we know that in order to really offer services to the great majority of folks, we need to really partner with employers and health plans and say, let's come together and solve these issues to make sure we're breaking down barriers. Things like, I don't have access to care, I can't leave work in order to get care, I don't have transportation. If we all partner together and shoulder that responsibility, many more people are going to get care and their outcomes are going to be much better.
Can you say anything at all about what you might be hearing from a gossip standpoint? We promise we won't tell anybody about licensing or about any of this other stuff that's kind of on the table in terms of like, this stuff goes away, or if it changes, we're all dealing with a new paradigm of supply demand imbalance in mental health care. Can you say anything at all about any of that stuff?
I wish I had an inside track, but what I will say is that there is a lot of optimism that some of the relaxation of laws around telehealth, excuse me, that may continue. We really hope that happens because practicing across state laws is so important. We know that in 50% of counties in the US, there's not one mental health provider. So we know that there are people in underserved areas, rural areas with no one to go to. So we're hoping that some of this endures. We hope that really will continue. The Biden administration has talked about mental health really wanting to solve these issues. So we are hopeful and eagerly crossing our fingers to see what happens.
All right, let's see if Jenny has any additional dirt to add. So what's ahead for, for One Medical, and specifically if you can talk about anything that you're hearing, let us in on the, what's happening behind those closed doors and the conversations that you're having with, whether it be about policy or whether it be about payment model or things moving forward that might have an impact on our supply and demand imbalance and mental health care moving forward.
Yeah, I will. First of all, I would just agree with everything that Dana said. She did it very, very well. I don't have much to add. She has more gossip than I do.
Come on, you guys.
I guess I would just add that the licensing issue, it is unfortunate that the average consumer doesn't understand how that's hurting them. And I would urge everyone on this call to write your legislator and say, this is insane. Why would it matter if we could get mental health services to the underserved county? Why are we preventing that from happening? Because the person doesn't have a license. And it's very, very scary for the provider, excuse me, who is threatened by having their license revoked if they violate this. This is so old school. So, and it is not going to support our, march into telehealth. In addition to that, One Medical will keep doing what we're doing, which is primary care based, relying on our partners in therapy, coaching, group visits, making sure we have a strong relationship with our membership base and communicating with them regularly. So this is a scary, scary time. And when the pandemic's over, we're reaching out to them constantly to reassure them, offer them services, but we've got to get beyond this and into a healthy world.
All right, Sean, I can't tell us the gossip. I gotta ask.
Yeah.
I'm gonna ask everybody. That's what makes a good gossip, right? It's like when you just you pick everybody's brain a little bit. So I'm curious to hear what you're hearing, especially, you're in a very unique position, I think, as a payer, because you've got to deal probably more with kind of what's coming down the pike long term, than either of these two ladies that have to deal with a lot more fires that are closer to home and more near term. So, tell us what you're looking at from a strategic standpoint moving forward. Have you heard anything about licensing? Have you heard anything about some of the policies that might be coming out over the next coming years to help, like we said, ease the supply demand burden here in mental health?
Yeah, no, I think in terms of priorities, I think pretty consistent with what you've heard. I think we've always had a pretty robust medical telehealth offering. I think the pandemic really jump-started that on the behavioral health side for us. And so as Dana mentioned, beginning to look more at integrating those two into a more holistic model, and happy to be working with Ginger on some of that. So that's one. Two is very much like I mentioned, I think we've got to begin to take a long-term view on what high-performing mental health networks will look like, how we better align incentives. That's not a, hey, let's do that next month kind of thing. That's let's start those discussions now and really build together over the next couple of years. And so I think those are going to be the two big priorities for us. I think in terms of policy, I'll give you one positive thing. I don't know that it's that gossip worthy, but it's one thing that I'm about. some of the loosening of the HIPAA restrictions, I think are going to go a long way. I think, especially towards some of the integration that we've mentioned, data and information sharing, especially, HIPAA was written well before some of the technological evolution that we've had today. And so it really has, I think at times, served as a decelerant to some of the integration and collaboration that could happen. So I'm very hopeful that some of those policy shifts will go a long way. I'll actually send a word of caution, potentially a little bit controversial, is that when you get a lot of attention like you have appropriately, there's often a risk for over-regulation. And that would probably be one of my biggest concerns is I think that what we need to do is, I think you framed it very well. We need to lay the right foundation and framework and then let the industry evolve into that in the right way. I think occasionally we see overeager regulators and legislators who kind of want to put their name on something and that results in some unintended downstream consequences that can actually reduce access and increase disparities, even though the approach was well intended, just because they didn't quite fully appreciate some of the complexities that are out there.
All right, great. We're leaving us in controversy. Thanks a lot, Sean, for that. No, but I think that's an excellent point. And I think that, that's something definitely, I think for everybody who's on here, to continue to watch, and I hope take away with them is, how do we as an industry support the successful growth of this infrastructure to support a different way to deliver mental health care in the future? I mean, clearly what we've got is stressed. In and of itself, it's stressed, right? Which is terrible. But no pun meant at all on that. But it is stress, and we need to figure out a different way to do it and adopt, a different mentality in terms of the way that we've been looking at this issue, all the way from back in those managed care days, Jenny, where it was carved out, and addressing the payment model around that, addressing the integration of care, addressing underserved populations, non-English speaking populations, and how do you loop technology in, especially now from where I sit in the healthcare ecosystem, watching these health tech companies get, hundreds of millions of dollars of funding. How can we leverage that into creating something that's completely new? So while this is a very challenging time, I think for, obviously a lot of patients, but also for all of us who are in the industry who want to fix the supply and demand imbalance, I also feel like it's a very hopeful time. And it sounds like, from what I heard from all of you, we're on the same page there, right? Hopeful? Yes, enthusiastic nodding all around. All right. Well, I want to thank you guys so much for joining us here today. We are just about out of time. We're actually right at the buzzer almost. So hopefully everyone can stick around and participate in the meditation that's afterward. There are a lot of unanswered questions in this chat. And so hopefully the team at Health will help us sort through those, and we can figure out how to get some of those unanswered questions answered. But thank you. I'd like to say thank you to you all for joining us here today. Thank you to Ginger for hosting, and thank you to Health. We'll see you guys soon. Thanks so much.
Thanks, everybody.
Hello, my name is Lauren Ersch, and I'm a health coach here at Ginger. And I'm going to be guiding us through a meditation today. I want to start by saying thank you to Jessica and Jenny and Dana and Sean for fostering such an inspiring and rich conversation. And today we're going to be practicing a mindfulness technique that I often use with Ginger members, which is progressive muscle relaxation and a guided visualization. So I invite you to clear your environment, clear your space of any distractions for just about 10 minutes. Maybe put your phone on airplane mode or silent. Make yourself comfortable. You can sit down, lay down, wherever you'd like. And I invite you to close your eyes. And taking a deep breath in, and fill your belly, your chest, nice long spine, holding at the top of the breath. And a big open mouth exhale, release. Good. Another deep, full, complete breath. Fill, expand, and lengthen. Hold at the top of the breath. And big open mouth sigh. And one more, biggest breath of your day, filling your stomach, filling your chest, holding at the top of the breath. And then open your mouth, sigh it out. And allow your breath to be natural and comfortable. And turning your gaze deeper within. And taking this time to practice self-care, self-love, and some of these preventative mindfulness tools. And I invite you to scan through your physical body and just notice how you are in this moment. Without judgment, without labeling, just observing. Notice where you feel tight or tense. And notice where you feel relaxed. And I encourage you to bring your awareness to the very top of your head. And imagine an energy of peace and calm begins to travel in through the top of your head. And I invite you to think about a color that represents and symbolizes peace and calm for you. And visualize this beautiful, vibrant color that you choose, traveling into your forehead, your temples, the muscles around the eyes. And it relaxes all of the muscles of your face. Unclench your jaw, relaxing your mouth, your cheeks, your throat, your neck. And sense that this peaceful light, this color that you choose, travels into your shoulders and relaxes all the tension in the shoulders. See if you can soften your shoulder blades down your back, away from your ears. Open up your collarbones. With every exhale, see if you can soften into this space. And allow this calming light and energy to travel down both of your arms, into your shoulders, biceps, triceps, elbows, forearms, wrists, hands. Relaxing both of your arms together. Invite you to guide your awareness to the back of your neck and sense this calming energy traveling down your spine, one vertebra at a time. Unwind and release. And feel rooted in your sit bones where you connect to your chair, grounding down. Imagine relaxing the muscles of your chest. This colored light traveling into your stomach and soothing all of your internal organs, working in harmony with one another. Relaxation traveling into your hips, the glutes, your thighs, your hamstrings. All of these strong muscle groups are limp and loose, relaxed. Imagine this peaceful light traveling into your knees, your calves, your ankles, your feet. Feel your feet connect to the ground, rooting down into this space, full presence here and now. Relaxing the whole left side of your body and relaxing the whole right side of your body. Relaxing your entire body, still and peaceful. Breathe, open, soften, and relax. Breathe, open, soften, and relax. I invite you to imagine that you are on a white sand beach. Imagining that you are transported to a white sand beach and feel your bare feet in the sand, the texture of the ground beneath you. And tuning into all of your senses and noticing what you see. Maybe some beautiful palm trees, a blue sky, an aqua ocean in front of you. And taking just a few moments to be here fully. Notice what you smell. Maybe the salty air, some hibiscus flowers, coconut. Tuning into all of your senses and feeling the warm sun on your skin. Feeling that warmth on your skin. And I invite you to walk towards the ocean, and admiring this beautiful turquoise clear water in front of you. So vast, and really admiring the horizon and this feeling of expansion, shifting your perspective. And imagine walking till your ankles are in the water and feel the temperature of the water on your feet. And imagining that any remaining stress or tension in your body, anything that you're worried about today or feeling stressed about, imagine that these worries and stress and tension flow out through the soles of your feet. Imagine that you can just release them in this moment and give them to the ocean below you. And allow the vast, expansive ocean to absorb, transmute, recycle this stress, this fear, this tension, as it leaves your body, your mind. And with a big exhale, sending any remaining worry, stress, fear, limiting beliefs out the soles of the feet and into the ocean. And feeling this peace, feeling grounded and clear. And taking some time to thank yourself for choosing to stay on this call just 10 minutes longer. An act of self-care and self-love for your mental, emotional, physical health. Thank you for being here.
Thank you